How are you?
Good, how are you?
Good. My name's Beth. I'm a student nurse and I will be doing your assessment today. I'm just going to take a piece of paper to write stuff down on. How are you feeling today?
Good.
Do you have any concerns or any issues?
None at all.
Okay. So what is your name?
Sarah.
What's your last name, Sarah?
Farmer.
Alright. And what's your birth date?
5/16 of 96.
Okay. So do you have any family history or anything that is concerning to you?
No.
Nothing like that? Okay. Well, why don't I start and we'll just do some basic vitals. I'll just have you put your feet flat on the floor for me. And I will grab a blood pressure and a pulse. And I'm just going to kind of listen to your heart and lungs a little bit, and then we'll scoot over to the table and then I'll poke around on your abdomen a little bit. Nothing that'll hurt. Okay. Alright, so we'll leave that set there. .76 for your pulse, which is normal. I'm just going to write that down so I don't forget. I'll have you uncross your legs just while I grab your blood pressure. Kind of hard. Everybody does it. Everybody crosses their legs when they sit down. Okay. 114/56. This is a nice low blood pressure. Do you have any family history of hypertension or high blood pressure?
Not that I know.
I'm just gonna write this down. Alright, so right now what I'm gonna do is just kind of assess your scalp
Okay.
and just see if you have any like lesions or abnormal bumps or any
Do you want this down?
painful. If you could pull your hair down, that would be great. I'm just gonna grab some gloves. Do you have any dry scalp or any itching? Notice any hair falling out or anything like that?
Nope.
Okay,
Not any more than usual.
nothing more than usual. So you do have a little bit. That's pretty
Yeah.
common. Yeah. Okay, so I'm just gonna have you look in your hair. You've never had any head lice or anything that you would be concerned about?
No.
Anything painful when I push on here?
No.
Nothing up in here. Okay, I'm just gonna kind of come right around here. How does that feel? Any pain?
Nope.
Okay. Have you noticed any lumps or bumps, any lesions or anything? Okay, why don't you just open your jaw for me? Any popping or clicking in there? No? Okay. So I'm just gonna do right like this. Just feeling for pulses just to make sure they're even. Okay. Have you ever had any problems with your skin?
I do have eczema.
You have a little eczema? Okay. And have you ever been treated for that eczema?
They just told me go and get the eczema lotion from the store. Nothing like from the doctor or anything.
Alright. Okay. So the next thing I'm gonna do is just kind of look in your eyes and in your nose and mouth here a little bit. And again, just looking for any lesions or abnormalities or anything like that. Have you noticed anything painful at all?
No.
Okay. So what I'm going to do is I'm just going to have you look that way for me. A little bit more if you can.
Okay.
Does that
With
hurt
my
your
head?
With your head, yeah.
Okay.
Not just your eyes, right. Okay. Okay, any problems with your hearing?
No.
Have you ever had any discharge or any kind of surgeries on your ears?
I've had tubes.
Tubes in both ears?
Yep.
Okay, and when did they take them out?
Ooh. Can I phone my mother?
Were you like a teenager?
No,
Were
I
you
was
little.
I was little.
Okay. Alright, so they look good. You do have some scarring on both eardrums, which is
Normal.
normal because you had the tubes in there. Alright, so I'm gonna have you just look up for me. I'm just gonna kind of snoop up your nose. You don't have any drainage or any sinus issues, any pressure or anything. Okay, everything looks good in there. It's all kind of pink and not too dry. Okay, so I'm just gonna push here on your sinuses. Tell me, does that hurt at all? Okay, anything hurt across here?
No.
Can I do that? Alright. Next thing I'm gonna do is I'm just gonna flick this light off and I'm gonna look into your eyes just to make sure you have what's called a red reflex, which is normal. And then I can also kind of see some of the arteries in your eyes. So I'm gonna hold my breath here for just a second and have a peek. Look straight ahead for me. And do the same thing on this side. Look, everything looks good. Okay, turn those lights back on. Okay, so I'm gonna look in your mouth. Have you noticed any like canker sores or sore spots? Any lesions? Do your gums bleed at all when you brush your teeth? How often do you brush your teeth?
Twice a day.
Twice a day, morning and night?
Yes.
Okay.
How would you
just,
yeah?
Just
Tongue out.
tongue out, and say ah. Okay, and say ah again. Okay, I'm gonna actually grab a stick here. Now what I'm looking for is a little thing that hangs in the back of your mouth. I'm just gonna pull your tongue down and I'm gonna watch that. So I want you to say ah,
Okay.
and it should rise evenly.
Okay.
Okay, so
Ah.
okay, now do it again. There you go. And I'm just gonna look at your tonsils back there, and you don't have any sore throat or anything like that. All your teeth look like they're in pretty good repair. When was your last dentist appointment?
Dental assistant schooling.
In dental assistant
Count
school?
that.
A couple of years ago? Or
Almost 2.
okay. Well, they recommend that you go twice a year, but you probably know that if you were in dental school for cleanings, and then if you have any issues, back more than that. Okay. So I'm just gonna kind of feel down your neck. It doesn't look like you have any lesions or anything. Any history of thyroid disorder?
No.
Okay. Can you swallow for me? Nothing, no soreness or tenderness here?
No.
Nothing here? Okay. Shoulders seem like they're good and straight. Okay, what I want you to do is grab my hands. I want you to squeeze them for me. Okay. And now I'm gonna have you go like this.
Okay.
Make fists. And I'm gonna pull. And I'm gonna push against me. All right. Now I'm gonna push down, and I want you to push towards me, like you're gonna kind of hit me. And we're gonna do the same thing on this side. Any pain with any of this?
No.
Okay. I'm gonna have you lift your arm for me. Any problems there?
No.
Any popping or clicking when I do any of this?
No.
Okay. And I'll do the same on this side. Any issues here?
No.
No tenderness, nothing like that?
I did whack it on the stairs, but it should be fine.
Okay. No problems that way.
No.
All right, what I'm gonna have you